My name's Chris Park. I'm a board certified plastic surgeon. Grew up in Mobile, Alabama, and after going to University of Virginia and University of Alabama at Birmingham for medical school and Wake Forest for my plastic surgery residency, I moved back home here to Mobile. Probably do more breast surgery than anything else. Probably do 8 to 10 breast surgeries a week, and definitely enjoy all types of breast surgery. So focusing on breast augmentation, I offer all the types of implants. I'm excited to get more active and more involved with the IDEAL Implant. I've always been a bigger fan of silicone implants than saline implants based on the feel and performance of them, as well as using saline only when I thought the patient had enough breast tissue to hide the downsides of breast implants. The downsides are that most standard saline implants don't feel quite as natural as a regular breast or a silicone implant. And then if you're thin or have thin breast tissue, you can feel the edges and even some folds and ripples in the implant. So traditionally, I've been a big fan of silicone implants, but I have been impressed and very happy with the IDEAL implants. They use a multi-lumen setup that allows the palpability of the implant to feel much more like a silicone implant. All the patients I've used it in, I've not regretted it a single time. They've all been happy. When I see them back post-operatively with my own fingers, I honestly can't tell the difference between silicone and saline. The size has been good, the shape has been good. I've not had any palpability issues. I've yet to see a rupture. I think the advantage here is we are accomplishing many of the advantages of the silicone implant, but also accomplishing the advantage of a saline implant without the disadvantages of a saline implant. I mean, it is nice to know, even though they have a silicone shell, that you're not putting silicone gel in your body. One of the advantages of saline in general is that you don't have to make that final decision in the office 2 weeks before, etc. You can play with a little bit on the table. Any implant that you can adjust obviously gives us some flexibility on the table. As much as I try to predict things exactly the way that I want it preoperatively, there are times that I wish I could just have a little more volume. We try to keep all lines of communication open. My staff knows that patients come first no matter what. If any single person emails our practice, it comes to me, the owner and the physician. We are very open to seeing our patients anytime they have concerns. We try to have a very thorough consultation process, educating on all the different options. We bring them back for always a separate preoperative appointment in which we're going to go over all the informed consent to make sure that these patients understand exactly what they're getting into. And then we're going to proceed with surgery. We always operate certified operating rooms using MD anesthesia with CRNAs, and making sure that our patient safety comes first. Definitely feel like that we are the place to go.